Welcome to this introduction to Public Health Department accreditation. Well, what is accreditation? And what does the health department need to do to be accredited? And why bother? By the way, this photo is the Oklahoma State Health Department celebrating when they first received accreditation. Now, accreditation of any organization assures customers and communities that the organization meets high standards. For example, hospitals are accredited by the Joint Commission. You probably don't want to go to a hospital that's lost its accreditation. Colleges and universities are accredited by the Council for Higher Education Accreditation. The Commission on Fire Accreditation International accredits fire departments. Even public libraries can be accredited. Accreditation tells the public that the hospital, the school, the fire department, or the library has been assessed and that it meets agreed upon standards. Public health departments are accredited by the Public Health Accreditation Board, or FAB. This webinar will provide an overview of what FAB accreditation requires, the process of becoming accredited, and we will address the question, why bother? The Public Health Accreditation Board, FAB, is the national organization that administers accreditation for local, state, and tribal public health departments. They've even accredited a national health department. The Ministry of Public Health in Qatar was accredited by FAB in August of 2022. FAB's mission is to advance and transform public health practice through performance improvement, strong infrastructure, and innovation. Their vision is a high-performing governmental public health system that supports all people living their healthiest lives. The FAB accreditation has always been about encouraging continuous quality improvement in health departments. Quality improvement has been built into both the requirements and the process for accreditation. So achieving accreditation is not about checking off boxes or getting a shiny plaque to hang on the wall, though the FAB accreditation plaque is very handsome. Accreditation is about the health department's capacity to provide public health services and its ongoing efforts to continue to improve. Well, let's review some of the basics of FAB accreditation. So any accreditation is an assessment of an organization or business by an independent, impartial third party. In this case, that independent and impartial third party is FAB. The assessment of the organization is always conducted against a recognized set of standards. If you meet the standards, you can be accredited. FAB has adopted a set of national standards that health departments must meet. This webinar will review the standards and measures and the documentation that is required for FAB accreditation. FAB accreditation is voluntary. That is, no governmental body or funding agency requires that health departments be accredited. Well, there is one state that requires that local health departments be accredited to receive state funding. Health departments are accredited by FAB for 5 years. After 5 years, the health department must be reaccredited. FAB standards do not reflect the minimum of what a health department should provide, but they're also not the gold standard. Instead, they are set at a moderate level. That is, they are intended to reflect current public health practice and be achievable. Importantly, being accredited is a continuing process. It's not a once and done project. It's a process that takes time and effort, but the process itself is valuable because it's the department's self-assessment, identification of gaps and areas that need to be addressed, and improvement. So health departments improve in the process of seeking to be accredited. FAB standards assess the department's capacity to perform public health functions. They do not evaluate how those functions are performed. FAB recognizes that communities are unique, and so it does not require health departments to fulfill their roles in prescribed ways. That is, FAB is not prescriptive about how the health department performs the required activities. The first accreditation of a health department was in early 2013. By the end of 2022, there were 315 accredited local health departments, that is, city, county, or regional health departments. 40 accredited state health departments, and 6 accredited tribal health departments, and at 1 national health department. Well, first, what are the requirements for accreditation? All of the requirements for accreditation are contained in this one document. The current set of FAB Public Health Department standards and measures is version 2022. This version went into effect in July of 2022. The FAB standards are organized by the 10 essential public health services. That is, FAB groups the standards by the 10 essential services and calls them domains. There are 10 domains of standards, and each domain corresponds to an essential public health service. So the domains are simply groups of standards. It's a way to organize them. The first domain or groups of standards is about assessment. The second is about investigation. The third is about communication, and so on. Each domain includes standards. Each standard includes one or more measure, and each measure includes required documentation. Now, required documentation is the written evidence or a document that the health department must provide to FAB to demonstrate that it meets the measures. The documentation includes written examples from the health department that will be submitted to FAB. Well, an example is here on this page for Measure 1.1.1. Measure 1.1.1 is the first domain, the first standard, and the first measure in the red circle in the upper left. The A means it pertains to all health departments. Some measures will say S for state or T for tribal. This page is also the required documentation 1 in the blue circle below the red circle. This measure requires a community health assessment. The required documentation is what the health department must submit to show that they meet the measure and standard. The requirements for how the community health assessment is developed and what the assessment includes are many and quite specific, and they'll appear along the left-hand side in the dark gray area. There are a total of 7 specific requirements, A through G, in the next few pages. In this case, the documentation must be an assessment, circled in purple in the upper right. Documentation for other measures may be, for example, minutes of a meeting, a policy statement, a plan, or even an email or letter that demonstrates that the activities were completed. The community health assessment must be dated and can be no older than 5 years old, as shown in the blue circle in the upper right. In this case, 1 assessment is required. Well, now let's look at another example. Let's look at domain 10. This is the group of standards that addresses the department's infrastructure. So the domain, as it says at the top, is to build and maintain a strong organizational infrastructure for public health. Now, at the bottom of the page, the 3 standards in this domain are listed. The first standard of domain 10 is to employ strategic planning skills. Well, what does that mean? Well, the next few pages of the standards and measures say exactly what that means. Now, as we know, domain 10, standard 10.1, is about strategic planning. And there are 3 measures in standard 10.1 that says that the department must employ strategic planning skills. And they are measure 10.1.1, conduct a department-wide strategic planning process. Measure 10.1.2, adopt a department-wide strategic plan. And measure 10.1.3, monitor the implementation of that strategic plan. So in effect, these measures say plan, implement, and monitor. So this is a basic quality improvement process built right into the measures. Plan, do, check. So we'll now look at the second measure, adopt a strategic plan. Well, that sounds clear enough, but of course, FAB has more specific requirements. These are the specific requirements of what must be included in a strategic plan. The plan must include the health department's mission, vision, and guiding principle statements. It needs to have strategic priorities. The plan must include objectives that are measurable and include timeframes. Strategies must be included, and a method to monitor the plan's implementation must be described. The strategic plan must show a direct link to the Community Health Improvement Plan and the department's performance management system. So it's important to keep all these requirements in mind when the strategic plan is being developed so that the plan meets every FAB requirement. Health departments don't want to go back and redo the plan in order to meet a FAB requirement. But this is true for all of the department's documents. That is, health departments should make sure that they meet FAB requirements as they develop or update them, so that the documents or the processes do not have to be redone later when the department applies for accreditation. Now that we've reviewed the structure of the requirements, we'll look at the types of documentation that are required. There are two types of documentations. The first is examples of the department's activities or capacity. For example, Measure 3.1.4 requires two examples of using social media to communicate about public health issues. Measure 7.2.1 requires two examples of an effort to improve access to social services. Now, this could be perhaps an MOU, press releases, meeting minutes, or a grant application that shows work to improve access. Measure 8.1.2 requires two examples of recruitment and hiring a qualified and diverse workforce. Now, this could be job descriptions or job announcements that could be submitted as examples. The second type of documentation is written and adopted plans, policies, or procedures. For example, a department-wide communications protocol is required for Measure 3.1.1. A surveillance protocol is required for Measure 2.1.1. Measure 10.1.1 requires written operational policies and procedures. The FAB Standards and Measures version 2022 requires 6 plans, 4 policy statements, and 20 written protocols and procedures, and a variety of other written documents. For example, a department policy related to health equity is required. What are the 6 plans? The Community Health Improvement Plan, the Strategic Plan, a Workforce Development Plan, your Emergency Operations Plan, a Quality Improvement Plan, and a Risk Communications Plan. A performance management system is required, and of course, the standards require a community health assessment. Health departments must have operational policies, health equity policy, human resources policies, and an information security policy. Included in the FAB requirements are a number of basic documents that are considered make or break accreditation documentation. That is, if the health department does not have these right, they'll not achieve accreditation without more work. The Community Health Assessment, Community Health Improvement Plan, and Strategic Plan are considered basic documents and are required for any health department. These documents drive what the health department does and how they work with the community. The Community Health Assessment must be a community-driven and community-owned document that describes the assets and health issues of the communities that the health department serves. Based on the assessment, the community will plan to improve the health of the population. Well, that's the Community Health Improvement Plan, or the CHIP. The health department may lead these processes, but they must be community engagement processes. The department's strategic plan will guide the health department. The strategic plan will relate to the implementation of the health improvement plan, but it will also include other department strategic initiatives, such as, for example, maybe expanding the funding base or working with county government on a policy that has public health implications. The quality improvement plan and the performance management systems go together and are also make or break measures. A system that monitors the health department's performance is a main measure to identify areas for improvement. and a plan for how quality improvement will be addressed and implemented is also required. Looking across the standards and measures, a few themes become evident. The first is community engagement. It appears many times throughout the standards and measures. And community engagement has always been, and it continues to be, a major focus of FAB's requirements. In the 2022 version, emergency preparedness requirements were expanded. Now, FAB, as well as public health departments, learned a lot about preparedness through the pandemic. So now there's a greater emphasis on preparedness for accreditation. Earlier versions of the standards and measures addressed health equity, but version 2022 has a much more rigorous requirements around health equity. Measure 5.2.4 requires that the department adopt a policy or procedure that demonstrates how health equity is incorporated as a goal into the development of programs that serve the community. Required documentation 10.1.2 requires that the department has adopted definitions for health equity terms. And measure 10.2.1.3 requires a policy, a declaration, or an initiative that reflects specific intentions with regard to inclusion, diversity, equity, or anti-racism. Now, there are steps that every health department can take immediately to prepare for accreditation and make documentation easier later. There are a few best practices that health departments need to keep in mind. They should apply these best practices to all health department documentations. They're the best practices for any organization that must manage documents and version control, whether they seek accreditation or not. First, health departments need to make sure that every document can be identified as belonging to that health department. FAB calls this evidence of authenticity. That is, the department belongs to that health department and not some other health department. The department logo or name needs to be included on all reports and policies. If the document is a plan developed by a community coalition, then the plan must list the members of the coalition, and that list must include the health department's name. Second, everything needs to have a date. A date on all documents is required for accreditation, but it will also ensure that in the future, the health department will know how old a particular policy or plan is and when it may need to be updated. It's also needed for version control. Dating all documents is a best practice for any and all documents in any and all organizations. Even flyers and brochures need to have a date. The date also helps provide evidence that the document is final and has been adopted by the health department. Draft documents are not accepted by FAB. Make sure that any signature lines are signed and not left blank. A blank signature line is seen as an indication that the document has not been adopted and it's still a draft. It's easy to forget to number pages for all documents that are more than one page long. Page numbers are needed to find specific information in documents and point FAB to specific places. This is also generally a best practice. Finally, adopt a department-wide naming convention for files. Make sure that the documents are saved with descriptive names so that they can be easily identified for selection as accreditation examples later. For example, not just coalition meeting, but Violence Prevention Coalition Meeting Minutes, February 2022. Not just branding strategy, April 2022, but branding strategy final, adopted 2022. Not inspection form, but restaurant inspection form, July 2022. Not just lab protocol, but lab specimen protocols, September 2022. File names that identify exactly what the document is will save enormous amounts of time later when the health department is selecting and organizing documentation for accreditation. So it's worth repeating that as health departments develop plans and policies, they should check the FAB standards and measures to see what is required. Here's an example. This is measure 3.1.4. Use a variety of methods to make information available to the public. The required documentation is a department website, and there are 12 things that a health department website must have. So make sure your website has them. Of course, there's an established process that every health department must follow to achieve accreditation, but we'll focus on the first few steps of the process. FAB lists 7 steps. The preparation step is the most important step. If a health department is not well prepared with their documentation, they will struggle through the process and may not be successful. For most health departments, this step takes 3 or 4 years. The community health assessment and the community health improvement plan both need to be developed. The development of these 2 documents is a community process, and each can easily take a year to complete. The strategic plan can also take a good amount of time to develop. Other documents, such as the QI plan, a quality improvement plan, and the workforce development plan, also need to be adopted and implemented. The accreditation requirements are the guidance for the development and selection of documentation. All documents must be dated and have evidence that they've been adopted and are in use by the health department. Step 1 also includes paying a fee and attending learning events. The health department will then submit a completed readiness assessment form. FAB staff will review this and provide a custom report concerning their assessment of the health department's readiness to apply for accreditation. Well, this is a new step that has been adopted recently to help make sure that health departments are truly ready when they apply for accreditation. The second accreditation step is simply to register with FAB and then to submit the application. This is done online. FAB's online accreditation system is called eFAB, and it's recently been updated and improved. The third step is critical, and the health departments have up to a year to complete it. The health department will upload documents into FAB's electronic system and then submit their documentation all at once to FAB. Now, most documents should be completed before the health department applies for accreditation. That means that this year of uploading documents is for selecting the most appropriate documentation, not for creating new documents. Deciding exactly which documents are going to be submitted to FAB as documentation is a process that involves a lot of staff. The documents that are submitted will be evaluated to see if the health department can be accredited. So deciding what will be submitted is very important. This is the health department's opportunity to tell their story. They should select documentation that will tell FAB what is unique about the communities that they serve and how they collaborate with others to improve health. They should choose documents that tell FAB who they are, what they do, and how they do it. Health departments should paint a picture with their documentation. Once the health department submits all the documentation, FAB staff will conduct a first review. For example, they will not accept any documentation that does not have a date. They will also complete an initial assessment of each measure as fully demonstrated, largely demonstrated, slightly demonstrated, or not demonstrated. They will inform the health department of which measures are slightly demonstrated or not demonstrated. Health departments will have 45 days to submit different documentation for all measures that are assessed as slightly or not demonstrated. The next step is review by a peer site visit team of volunteers. They will also conduct a site visit. Every measure will be assessed as one of the 4 assessment choices: fully, largely, slightly, or not demonstrated. The site visit team will submit a report to FAB for a decision. The accreditation decision will be made by FAB's accreditation committee. The process of attaining accreditation status involves everyone in the health department, all of the staff, the health department director, even the board of health members, and yes, even the department's community partners. There will be various roles that individuals will play, and the process needs to be organized, but everyone will play a role. When a health department receives accreditation, it will be a shared achievement that everyone in the health department will be part of and will celebrate. It will be something that everyone will be proud of. Leadership support for the process is key to ensuring that everyone is on board. The health department director will inform and gain the support of the Board of Health. The director will also ensure that the time and the resources for the effort are allocated and supported. Every applicant health department must appoint one person to be their accreditation coordinator. This is required by FAB. This person will be the single point of contact between FAB and the health department. This person will manage the process for the department. There is FAB guidance online about selecting the accreditation coordinator. Of course, a good project manager who's very well organized is needed for this position. The accreditation coordinator must also have the authority to make assignments and set due dates. Well, other than that, health departments can organize their accreditation pretty much any way they want. But most health departments appoint a team that works with the accreditation coordinator. This team assists in the identification and selection of the documents that will be submitted to FAB. The team members will be assigned domains. Sub-teams may also be created to work on specific measures or groups of measures. Other individuals may be designated as champions to help the department track and celebrate its progress. For example, one health department created a fun accreditation process map. It looked like a board game. The champions will also keep the community informed and engaged. Now, everyone can and should contribute to the effort. They can suggest documentation to use, ways to get the word out, ways to explain the value of accreditation to others, and ways to celebrate milestones along the way. And celebrations along the way at various steps in the process is very important. Health departments can celebrate when they submit all their documentation, when their site visit is completed and over, and when they receive accreditation. Well, this is a photo of the Tulsa Health Department celebrating when they were accredited. Well, why go through all of this? Accreditation is about continuous improvement of the health department. The process of seeking accreditation requires that the health department develops capacity and capabilities needed to address public health in their communities. It's not an easy process, but it shouldn't be easy. Some of the benefits are anecdotal. Many health departments say that the accreditation process was team building for the department staff. And staff said that working together through the process, they gained a better understanding of others' jobs and also how their own work contributed to the big picture of improved health of the public. Some health department directors say that accreditation resulted in improved department processes, accountability, and community collaboration. Health department directors have also said that the accreditation process has been invaluable for quality improvement. FAB has conducted a number of evaluations and studies to quantify the benefits of accreditation. The major areas of benefits that they've identified are quality and performance improvement, community collaboration and partnerships, a stronger emphasis on health equity, being in a better position to seek funding, and an improved capacity to be responsive during emergencies. Now, there are many FAB resources online, including written guides, webinars, tip sheets about requirements and process of EFAB, fact sheets and videos that can be used to inform the community, board members, and the staff, and training for the accreditation coordinator that he or she's required to attend. The policy for initial accreditation at the top of this list is the guide to the process. The other important document, of course, is the standards and measures that lists and describe the requirements for accreditation. But there's much more guidance and tools, many tools, on the FAB website, fabboard.org. Now, the FAB website and resources will provide information about the accreditation process and requirements. FAB can interpret the standards and measures and their intent. They can help guide the health departments through each step of the process, but they cannot help health departments develop the policies, processes, programs, and plans that are required by FAB. Well, that would create a conflict of interest because they would be assessing documents that they help develop. The organizations listed here all have resources that help health departments create policies, plans, and processes required for accreditation. For example, NACCHO's MAP process, that stands for Mobilizing Action Through Planning and Partnerships, is the state-of-the-art model for the development of the CHA and the CHIP. The Public Health Foundation, for example, has expertise and resources concerning quality improvement. And there are other national resources to help health departments prepare for accreditation. Accreditation helps health departments to continually improve while building health and equity in their community. Thank you for your interest in public health accreditation, and good luck on your path toward accreditation. Have a wonderful rest of your day.